Okay.
Assalamu alaikum, the communication day. First scenario, this lady, 43 years old, was admitted 1 week ago with a 4 week history of fever associated with tiredness, weight loss about 3 to 4 kilograms. Her past medical history is blameless and she's not taking any regular medication. No, she denies the travel history. The summary of the history: patient did everything, investigation, done, revealed normocytic anemia, elevated ESR, C-reactive protein, low serum albumin, low serum iron, mildly elevated ferritin, white blood cells and account peripheral blood film, liver and renal thyroid scans, all are normal. The virology as well, screening was negative for HIV, for hepatitis B and C, COVID-19, Epstein-Barr virus, chest X-rays, CT cap, all of them are negative. She discussed with the hematologist, rheumatologist, and consultant in infectious disease. The consensus opinion was to ask for fluorodeoxyglucose positron emission tomography PET scan. You are the registrar in the ward. The patient asked you to update her husband, whom you have not met. She says he is quite vexed that you have done numerous tests and still not given them a clear answer. Ready, Dr. Henry?
Yes.
Okay, here you go.
Hello. Good morning. I'm Dr. Henry. May I confirm you are the husband to one of our patients here?
Yes, doctor. Hello. I am Yang Fiel, the husband of Mrs. Tai Fiel.
Okay. Actually, your wife told us about you and asked that you are coming today that we should discuss with you. Is this environment conducive for us to discuss, or you want any of your relatives to be here while we discuss?
It's all right, doctor. No problem.
Okay. Just to ensure that we're on the same page, could you please tell me what you know concerning your wife's condition to this very moment?
Yes, my wife suffered now 4 weeks ago from high body temperature. We gone to her GB, had done blood tests, and firstly he said it may be virus, and the result show increase abnormal inflammatory parameters. And he said to us we should wait for 1 week or 10 days. After that, he done another blood test and was still high. So has referral to your hospital, and she is now since 1 week in the hospital every day doing 100 of blood tests, urine tests, X-rays, and scans. And I don't know what's the problem with my wife.
I quite imagine how frustrated this must have been, having going through all these processes and putting you in such a distressing situation. First of all, I want to apologize for the delay so far, and also want to acknowledge the fact that you have this knowledge concerning your wife's condition. However, what you've said so far is in place. We've looked at her, and considering what she presented with, we are still not able to, get a diagnosis for her. However, recently some team of doctors came in, the blood doctors, the infectious doctors, and they all came in together and looked at your wife's case, and they are all of the opinion that your wife may need another, I'm so sorry, test to be done. And the name of this test that they are thinking is a kind of test in which we call it fluorodeoxyglucose positron emission tomography, computer tomography, which is in short from FDG PET CT scan. Have you heard of that before?
No, doctor. Do you know what are you doing? She has already hundred of blood tests and scans, and I need second opinion because that's disappointing for me.
I know this must be very difficult for you, but as it is now, all the tests we've done came out to be normal, and we truly know that what he has is something that we can really diagnose. However, we've not really exhausted all our tests for her. That is why the team of doctors have decided to try this one to see if there's any source that we can be able to pinpoint as the likely cause of our condition. Do you want me to tell you more about this test, if you don't mind?
Okay, doctor.
Okay, thank you very much. However, this particular test typically is a special kind of picture imaging test. Is an advanced imaging test, which is kind of, or some people call it an advanced X-ray, because in this case it is a kind of procedure we do to detect certain source of cancer in the organs, in different organs. This particular test usually before the test they look at the individual. Can you hear me?
Yes,
Sorry.
doctor.
Usually before the test, they usually get one of the blood channels, sometimes through the leg, sometimes maybe through the hands. The hand blood channels, they put a dye that we go through, circulate through the body system, and then if there's any source of activity, it will react with the dye and then serve as a picture for us to see that there's an activity going on there. Most likely it is used to detect some cancerous activity that is not picked by the normal X-ray and other scan that we have done before for her. I don't know if that is clear so far.
How this scan is better than the one that you have done already?
Your question is valid. Then this one tends to pick out some tiny cancer cells that cannot be picked by the previous one we've done. However, it comes with its own complication, which is sometimes it can't, because it's a dye we are passing. The person can have a little bit of discomfort in the sites, and then sometimes if there's any, it can cause kidney failure, in some individual. However, not to worry, we have all it takes to manage it when it arises. And sometimes some individual tends to react to those dye that is being passed. And also want to assure you that you don't have to worry again, because when those things come, we have all it takes to manage those complications when it arises. I don't know if what I've said so far makes sense.
Yes, I'm worried, doctor, and I'm worried if this scan will definitely give an answer and why was not done earlier.
Actually, your question is in place, because the reason why we don't do it earlier, because we it is more it is it the it is it it's we usually exhaust other options first that we've done. We usually keep it as the one of our last options for us to see where the likely source of some cancer that we cannot see by the other ones can really by the other ones that we've done previously for her. So that is why we are doing it now.
Okay. You have said that you will inject substance in her body.
Yes,
2
actually.
minutes left.
Yes.
Is there any risk for this substance?
like I said, the risk is some persons tend to react to those substances in some individuals, and then some they tend to develop kidney injury, and then some there can be pain in the sites of the injection, and these are the likely complication that may arise. But not to worry, we have all it takes to manage those complications when they come. Do you have any other concern?
Yes, doctor. My uncle is the retired GB in Taiwan. He suggested that steroid should be tried to control the fever.
Hmm. I know this is your comments is valid, but typically, like it is, we've not gotten the diagnosis yet. I don't think going blindly and starting steroid without getting a diagnosis would be appropriate. But may I know why you think your steroid would be okay for her, as suggested by your uncle?
Sorry?
May I know why you think the steroid would be okay for her, as suggested by your uncle?
Yes, I said to you, I have called my uncle. He is GB in Taiwan, and he said to
Yes.
me, in these cases, uh, should be try steroid.
Yes. Like I said, we've not gotten the diagnosis yet, so we think that certain steroid will not be to his own best interest now until diagnosis has been arrived at. Any other concern?
Time is up.
Yeah, time is up. Thank you, Dr. Ahmed.
Okay.
Well done, Dr. Henry, by the way. Now, Dr. Ahmed comment, then I will comment.
So regarding firstly, the Dr. Henry has explained the procedure and the task, which is the PET CT. But the patient has concern firstly that he wants second opinion, and he didn't answer this concern. Secondly, this investigation PET CT will use not dye, but also there is special radiolabel material which has many hazards. It's young age and may have children, and should in the safety ask don't contact with young children or pregnant women. Otherwise, he missed in the social history if she has kids and what is are doing for her living, and what is the impact on any support. And also, there is no, for safety netting, also brochure or leaflet to provide the surrogate at the end.
Okay, perfect. So let's go to the skills one by one. Clinical communication. What do you think? How about his performance?
It's borderline because the communication he didn't answer. I have a concern and he didn't answer me regarding the second opinion.
Okay, and the clinical judgment?
Clinical judgment is satisfactory.
Okay.
Sorry, judge borderline because here is a safety issue with contact with pregnant woman and children after this investigation.
Okay, the concern?
Concern also borderline because one is missed.
The last concern, yes.
Mm.
And welfare?
Welfare also will minus because welfare is not only for the patient but also for the family, and the impact on social support was missed.
Okay. Although he did perfect, and it's not common scenario, new scenario, but yeah, maybe because this is the calibration from Dr. Ahmed. And I want to correct something also. He added the dye, it's glucose containing. So no harm on the kidney, Dr. Henry. If yeah, yes, Dr. Ahmed.
Actually, Dr. Basim, it is a combination of CT and PET.
Okay,
So
so there
they
is contrast you want to
there
say?
is contrast and also sugar
Also,
labeled
mm,
radiopharmaceutical.
perfect. So he mentioned it correctly.
Yeah.
So it will be perfect if he mentioned the dye as a side effect to the kidney, as well as the allergy. Don't forget, whenever you are injecting different substance or something weird to the body and the body doesn't know it, it can cause allergy. So you can say it can happen immediately as a reaction. Okay, this is for any medication can be given for first time. You can give him alarm that sometimes after we inject new substance for the body, which here is contrast or the dye itself, it can lead to allergic reaction or reaction in the form of either skin rash or itchiness, or even in life-threatening condition, it might lead to hypotension and life-threatening one. But don't worry, as you said, the team will be around. We will react and we will do the best action whenever this happen. And we will monitor, of course, after that. The kidney also monitoring, as you said. Along with the glucose itself should be normalized. If she has diabetes, the blood sugar should be maintained as normoglycemic. Not to mention to the patient or to the husband, but just to say it as safety netting. Any patient has high blood sugar should be controlled before injecting this substance. It's uh, it's a good thing to know about this procedure in a training session rather than facing it in the exam. Okay. For me, it's new one in the session even. Thank you, Dr. Ahmed, to bring such scenario because you don't know what you will face in the exam. You might have this PET scan explanation and you don't know anything about it. Let's imagine for any candidate who face a new scenario in exam, what I should do. Not only new and lengthy scenario. So this advice will be general advice for any lengthy scenario. And the same time, you don't know about this scenario before or this procedure before. Blindly, you can start your introduction as every scenario. I am Dr. Henry, one of the doctors here. You are Mr. X. You are the husband of Mrs. X. She is 40 years. Yes, I am doctor. I'm here to discuss about her condition and assume she give us the permission to talk with you. Or you can say she asked us to discuss the condition with you as written in the scenario. At least what I will say now, it will take 2 minutes or 3 minutes. Can you tell me by your own word what happened with Mrs. X? What exactly? What do you know about her condition? Yes, doctor, I know that she's suffering long time. She's going and coming with this fever. No one helped her. No one diagnosed her. She did a lot of tests. I appreciate sharing this with me. Thank you. And I'm so sorry. It must be difficult for her or for difficult for you as well. I know this is frustrating for you. Okay. And no need to apologize here at all, Dr. Henry, because I heard you apologized for once. No need. Just be sorry for him. I'm so sorry for her suffering. And be sure that we are here to help her and to provide her the maximum and what we can help as a care. Thank you, doctor. So, Mr. X, can you give me some expectation? What do you think ongoing with her? Why she is having this fever all this time? Doctor, I'm worried. Is it cancer? Is it infection, doctor? I'm worried about her. So you can ask him as a big expectation. He will tell you. Then, according to this expectation, you have to give him an answer. Why? It's one of his concerns. Is it a cancer, doctor? I'm afraid to say it might be a cancer. That's why we want to do this test. Our test today will help us to diagnose here is it a cancer or hidden infection in her body. Sometimes some infection will not be picked up by the imaging, which is CT, usual CT scan. That's why we are here to tell you about our procedure today. What doctor procedure? Now you can say the name as exactly you did. Okay, full name, and then you can say we are abbreviating it as PET scan. Have you ever heard about it? No, doctor. Please explain for me. You want me to explain? Yes, doctor. Please explain for me. Then start to explain what is the procedure. If you know about it, if you don't know, let's imagine you don't know anything about PET scan. You can tell him simply, this procedure supposed to be prepared before doing it. We have to admit Mrs. X to the hospital, and we will do some blood test before starting doing this procedure. We will be sure that she can do this test. I don't know anything about PET scan right now, okay? I'm trying to just play with the time and with the surrogate this game and buy some time, okay? I'm buying time and I am playing with the surrogate. So this scan will be prepared. Everything will be monitored before the scan. As I said, with every procedure, before, during, and after. During the procedure, Mrs. X will be asleep on the machine that can inject the dye into her blood channel. And after injecting this dye, we will have some imaging by our machine. Are you agree? Sorry, do you follow me so far? Yes, I am following you. Now, during finished, sometimes during injecting this dye, reaction or allergic reaction might happen in the form of whatever skin rash or itchiness. But don't worry, we are there. We will be there. We'll be around. We'll try to take action immediately whenever it happens. Are you following me? Yes, doctor. After the procedure, we will let Mrs. X sleep or in the ward for a couple of hours to monitor her, to check if she has any reaction, and to monitor the blood or the kidney function, that no rise on her kidney function. How that sound for you, the doctor? Is it something important to do? Yes. Why you didn't do before? As Dr. Henry said, some advanced tests, we keep it for the last time or for the last chance or for the advanced condition to be diagnosed with it. One of these tests, our test today, our procedure today. Doctor, I have an uncle in Taiwan, in whatever the place, and he advised to give steroid. What do you think, Dr. Henry? You can answer him with the simplest answer. Simplest answer, you can answer it, by the way. Don't be panic. I don't want anyone to be panic if he face such concern, something new for me. Oh my God, what can I answer now? What can I tell him? Dr. Henry, can you tell me what you can tell him? My uncle in Taiwan, he's GP, and he told me to give a steroid. What do you think, doctor, about steroid?
First of all, your question, your concern is valid. Actually, if I may ask, may I know the reason why you think steroid is okay for her?
Okay, now you are trying to utilize some time, and you will waste the time, okay, not answering the concern, and you will lose the concern mark for this concern. You didn't give an answer. You just play with him the same game. What do you think the importance, or what do you think the need to give steroid here? He will tell you because he told me to give the steroids. Again, we will reflect the answer by another question. So what you will answer? I need clear answer, Dr. Henry. What your opinion regarding the steroid?
Yeah, steroid itself.
Forget about clinical judgment. I need an answer as a concern.
Yeah, yes, steroid is a
See,
a medication.
now you are answering as clinical judgment. I told you don't answer it as a clinical judgment. I need concern answer. I want you, because my uncle gave me advice to give a steroid. I want you, though, doctor, to give the steroid. Anyone
Steroid
has an
function.
answer?
Okay.
Yes, we can
Yes.
say.
Okay. Please go
Yes.
ahead. No, Dr. Ahmed, please go ahead.
Okay,
Okay.
Dr. Ahmed first.
Okay. I can answer. Steroid still tried in parts of the world where this scan are not available. And I hope I wait until performing this scanning if there
Okay,
is disease, not to mask this disease.
perfect. So you can say simply and safely, we can wait until finishing this procedure to have a clear diagnosis, and we can see later on if the steroid will be appropriate or no. This is an answer which is clear, and again, I buy a time. I didn't give him yes or no. Another
I
safe.
have I do have another suggestive answer, Dr. Basim. If you have an answer, please go first. If you
Yeah,
have
my
another
answer will
suggestion.
be as every concern not related to me and belong to other department, and this is what I want Dr. Henry to say. Okay, I will say this advice to my senior, to the team who are following Mrs. X, and they will see if she can take this medication or no, and if this medication is safe for her condition right now or no. Now, I didn't
W-
say no, I didn't say yes, I didn't give him approval. I just said to him, I will discuss with this issue with my. This is again, as a concern answer, not as a clinical judgment. If you want to talk about clinical judgment, steroid and for fever for unknown etiology, now we can have a lot of opinion. Dr. Omar will tell us one of the opinion now. What do you want Dr. Omar to
no,
say?
what I wanted to say is the diplomatic answer.
Okay.
Dr. Henry, you need to ask yourself a very first question. Is this case is complex? Yes. How many teams it's under? It's under rheumatology,
Yes.
cancer doctor said it under multiple teams. So this case must have been discussed, although it's
Exactly.
not written. It must have been discussed in MDT. Did have an MDT meeting. I'm conveying this message to Dr. Henry because he's aware of that, but he might forget that during the performance.
Yes.
So, Dr. Henry, any complex case like this, the consultant responsible for it will flag it to for MDT. So she will be having rheumatology MDT or fever of unknown origin or primary of unknown origin MDT. They will recommend doing the FDG PET scan. Okay, you as a junior or we as a junior, we will fill in the request form and email it to the PET scan department, and the department will contact the patient, and the patient will giving him the instructions how to prepare and how when is the timing. Usually, PET scan, if it's done in an outpatient setting, the patient doesn't require admission. It's just a stay for 6 hours, and then he can go home with minimal contact around. But to answer the steroid question, oh, my uncle is thinking that's a different disease. Let's forget about that specific medication. So this patient has been discussed already within the MDT. Multiple
Exactly.
consultants have given an opinion, and if they didn't feel that the steroid would benefit her, I would find it difficult to go for that. What does this sound to you? Oh, doctor, I would. No, I don't think so. I need. So you can have a second opinion. This is the.
Exactly.
You need to give him. You need to give him uh, the freedom of expressing his thoughts. Yeah, it's okay. Our consultant will speak to you about it, and they would like to see how you are dealing with uncertainty. It's one of the things that you will be assessed for. If you are facing a situation that you are uncertain, a disease that you have never you didn't knew about, a disease that or a medication that's very new you don't have any knowledge about, how you will react if you are facing uncertainty. And it's one of the capabilities in practice that they test. Um, uh, they test the hour level before the paces. How you will do you how you will you do or manage the patient safely while is dealing with uncertain condition or uncertain in situation that you don't know what to do, like this situation. Did you get my point?
Yeah. So
Yeah,
this
yeah,
is the
yeah.
same opinion I mentioned. Don't
Yes.
answer as I am the one managing here. I am the one treating here. I am the one taking care, and I will give her the medication. No, it's not your decision. Even if you are agreed, there is MDT, there is dermatology, there is infectious disease. There is other department who are taking care of her, and they will take the decision in the best interest. And I would like to add to Dr. Omar sentence, if it's in the best interest of her condition, why not? We can give her this medication. So don't go with no, I will not give. Why? He will argue with you. No, doctor, I want to give her the medication. I prefer to do it in the okay way, not in the disagree way.
Well,
Okay.
yeah, I will raise this concern on her behalf to our consultant and the team, so they
Exactly.
can have they can discuss one further answer that came into my mind right now. So you are the way that they assess the concern is have you addressed it? Yes, you don't know the answer to the concern, so you've passed it to the experienced, which is one of the ways of addressing the concern. Some concerns you will deal with it. Some concerns you need to pass it to the experienced, like in a
Exactly.
form of referral or to your senior, or uh, signpost it to one of the other members of the MDT, like PTOT, like uh, occupational health, like for
Yeah.
example, when she will be able to travel for the same patient after having
Perfect.
the FD
The
the PET
scan.
scan.
Mhm.
The question now is, Dr. Rahman, who
Yes,
brought this
only
in?
one day. One day should avoid
Yeah,
contact with pregnant and kinder and children, and can travel after one day.
yeah,
Perfect.
minimum
Please.
six
This is
hours. Yeah, safest one day. Yeah,
yeah. So if you know the answer, now you can say it clearly. What if you don't know the answer? How can I
I'll check
answer
with
it?
the
Exactly.
radiology department
Perfect.
and let you know.
Exactly. I will ask the assigned team or the doctor or the one who will do this procedure for her, and I will update you in the next meeting. The communication scenarios is not to judge you in your knowledge. No, they judge you how to manage every concern and how to communicate with the surrogate. Be smart. Don't say wrong answer. Don't judge by yourself. You are not the only one treating the patient or the you are not the team. You are one of the members of the team. Okay. One also point you can add to the all procedure, as every procedure we know, the consent. We will be sure that Mrs. X will sign the consent before doing this procedure. Why? It needs to be there. Not the husband, okay? Don't say you will sign. Yeah, we are here to discuss with you, but the wife will sign the consent, and it will be one of the
And for the consent, Dr. Basim, it will be by the radiologist, not by the clinicians.
yeah, whatever. But
The
there is a
cons
consent form.
yeah, this is what I wanted. So don't volunteer in this kind of scenario to consent the patient because you are not the one who will perform the scan, because it's one of the uh, it's not like the CT,
Yes,
so
yes.
it's not your area. This
Yeah,
is what I
suppose,
wanted to.
yeah, not only this procedure, any procedure supposed to refer the primary or the one who will do it, the consent form will be referred to him to fulfill this form and to be signed by the patient in front of this doctor or in front of this department responsible. Otherwise, I think Dr. Henry, he knows how to communicate, how to signpost and give answer. Don't talk more, Dr. Henry. Try to address if he's following you from now, from time to time. Don't speak lengthy because I found in the first 2 or 3 minutes, you start to explain the PET scan. You didn't give him a chance to react, or you didn't ask him if he's following you. You did so, but later on, okay, after a long time. Anyway, it's not, this point is not fatal, but try to keep it in your mind that I have to stop every now and then to ask him if he's following me, how that sound for him, because it's a conversation way, not as talking only. Okay.
Right. Thank you.
Okay, Dr. Inari, you
Yeah.
have any question
Thank
for
you.
this scenario?
No, I know. I got all the information. Thank you so much. Dr. Bazum. Thank you, Dr. Omar.
Anyone want to add any comments? Dr. Ahmed? Anything we missed?
No, thank you.
Thank you for the doctors who bring new ideas, because usually we are repeating the procedure, we are repeating the counseling, but for those who brought new scenario and new ideas, like our PET scan today, actually it will be discussed once, maybe in the old channel, video channel, I mean, but at least it will be there. Some other scenarios will be repeated, which is okay, high yield, but the one we will bring it once, it might be in your mind forever. For the repetition, some doctors will tell you, oh my God, I heard this before, so skip. But for the bit scan, I think a lot of doctors will listen to it because it will not be repeated frequently. So again, thank you, Dr. Ahmed, for
Thank you for your Dr. Basma.
Okay, most welcome. Now we will move to the next scenario. The scenario, you are the GI registrar, Mr. Rahman, 62 years old man, was investigated for iron deficiency anemia and intermittent abdominal pain. 2 days ago, a colonoscopy was done and it revealed a mass in the sigmoid colon. And biopsy confirmed adenocarcinoma of the colon. Staging CT has shown no distant metastasis. But the tumor is locally advanced and requires surgical resection. Today, Mr. Rahman come with his family to collect and to report and to discuss his health problem. He looks worried and wants to talk to on-call duty doctor. Your task is to explain the diagnosis, answer the patient's concern, and outline the next steps. Mr. Rahman is 62 years old man. Okay. 2 minutes, Dr. Ahmed, then we'll start. This is
Okay,
the
I
time.
can start.
You can start?
Yeah.
Okay, perfect. Here you go.
Hello, I am Dr. Mansour, one of the doctor in the gut clinic.
Hello, doctor.
Can I confirm your name and age, please?
Yes, I'm Mr. Rahman. I'm 62 years old, doctor.
Hello, Mr. Rahman. Mr. Rahman, do you want anyone to attend this meeting with you?
Actually, I came with my family members. They are here with me. Yeah, they can attend with me. Yes, doctor.
Welcome, Mr. Rahman.
Thank you, doctor.
How are you doing today, Mr. Rahman?
Doctor, I'm not so fine. I'm worried. I want to know what is wrong with me, doctor.
I'm sorry for that. And what do you know about your medical condition, Mr. Rahman?
And doctor, I've been having this tummy pain. It comes and goes for a very long time. The doctors came and they told me that after they took my history, they told me that I was very pale. They did some tests for me, and the colon doctor also came and he scoped me, and then he told me that he found a mass and he took a sample from the mass. So I'm here to know what I have, doctor.
Okay, and what is your expectation, Mr. Rahman?
I'm just scared. I just hope it is not cancer, doctor.
Oh, the result of this camera test and the biopsy test was revealed.
Okay, doctor. Hope it's a good news.
Unfortunately, the result revealed colon cancer.
Colon cancer? Oh no. I didn't expect that, however, doctor.
Sorry.
Doctor, does it mean I'm going to die? Doctor.
I understand your feeling now, Mr. Rahman, and how it is difficult for you. I give him tissue. Give 30 seconds.
Thank you, doctor. Thank you. Thank you.
It's suitable to complete or now or?
Doctor, go ahead. What is the next step now, doctor?
Do you want to explain this disease, Mr. Rahman?
Okay, doctor.
This cancer is abnormal growth of the tissue of your large tongue, which are uncontrolled growth, what's called cancer. That's the bad news. But the good news, we have scanning for your body and revealed that you have early stages of this cancer. That's the good news. And if we treat that, you are free from cancer.
Oh, that's good. That's good. So, but doctor, do I need a chemotherapy?
That's a good question. Thank you for. But let me to speak about the different therapy modalities, what we have to treat this cancer. We have meeting, including group of doctors, gut doctor and gut surgeon, and specialized doctor for giving chemotherapy called oncologist. And for the best interest of in your case, this team has decided to go for surgery, what's called precision medicine, that every case will be treated individually according to many circumstances. And for the best interest of in your case, it's not chemotherapy, not radiotherapy, but surgery in your case.
Okay, doctor. But doctor, what do you think is the likely cause of this cancer, doctor?
This is a valid question. Many factors play a role in this law. One of them is the diet. One of them also may be family. Sometimes runs in the family, and smoking, and if any other disease in the bowel before.
Okay, doctor. Doctor, is it contagious?
No, doctor, not at all, Mr. Rahman. Do you want me to explain more about the surgery and what is the decision of the team?
Okay, go ahead, doctor.
Firstly, we will admit you, we'll do preparation for this surgery. We'll do some blood test. The day of the operation, the doctor will give you numbing agent that called anesthesia to make you free from pain and make you sleepy. The surgeon will have meeting with you, describe the step of operation. There are two types or two methods to doing this operation. One of them is through tiny incision and using a camera called the laparoscopic surgery, and the other will do some little large incision to go direct exposure and remove this. But it's dependent in your case, and we'll talk this with the surgeon.
Okay, doctor.
After the procedure, the surgery, we'll maintain you in the ward to recovery and start with you with fluidy diet until healing of your derma again. After discharge, we'll accompany you throughout your journey. You will come in regular follow-up, doing scanning of your liver and organs, and yearly we'll do camera test. Are you following me, Mr. Rahman?
Yes, I'm following you, doctor. I'm following you.
Every surgery or every intervention in medicine has benefit and has side effect or what's called complication. It rarely happened with our expert team, We doing that in regular daily basis, so the complication rate is low. But I should mention this complication. One of this, the complication of numbing agent may cause lung inflammation or injury of the teeth or in the mouth. From the surgery, may be bleeding, or after that bleeding, maybe infection. One important thing is the bowel motion after this surgery. In the first months will be more than before. That's why I advise you after the surgery to take more fluids to replace what you have lost.
2 minutes left.
Do you have
Okay.
any concern, Mr. Rahman?
Yes, doctor. Doctor, will it come back again after the surgery? Can it come back again, sorry, after the surgery?
In your case, it's rarely that happen, and we'll keep you in regular follow-up. As I said, I will give you a written plan for the follow-up. If it happen, we'll catch it early. Do you have any other concern, Mr. Rahman?
Yes, doctor. Doctor, can I keep working, going for my, after the surgery?
Yes, we will leave sick note for the first 2 weeks, and after that you can. What are you doing for living, Mr. Rahman? Can I ask?
Yes, I'm a mechanic. Yeah, I work as a car mechanic.
And how does it impact your daily activity?
Doctor, it has been hell. I can't bend down. Whenever I go to work, I keep on having this pain. I have to sometimes allow my son to continue working.
Sorry
and I've
for
lost
that.
a lot of customers. Yeah.
Sorry for that, Mr. Rahman. I will refer you to occupational therapist to help you in this regard. Do you want any mood doctor to support you?
Mood? I'm not depressed. Where will a mood doctor come and support me?
To cope with this diagnosis and the bad news, if you want.
No, I don't think. I don't think I might need any mood
Do you,
doctor.
I have another question. Do you smoke, Mr. Rahman?
Doctor, that is my problem, doctor. I've been smoking so bad.
I advise you to stop smoking because that's one of the risk factor to develop this cancer. To prevent this to come again.
Time is up. Yeah, time is up.
Thank you.
Yeah, thank you, Dr. Ahmed. Well done. Now, Dr. Henry, you can comment.
Yeah, Dr. Ahmed, this was a good one. As usual, you've done well. You took your time, for the marking scheme. You got your clinical judgments is okay, satisfactory, welfare, satisfactory, your concern, at least you've managed my concern, you addressed my concern, which was also okay, except just one concern, it didn't really, just one that is left. I think, that is left. What support is available for me? That was my last concern, but I'll still give you satisfactory because you addressed 3 out of the 4 concerns I have, which is good. Then for the last one, which is welfare, clinical judgments, concern, and what was the last one again? Sorry. Let me see. What was the last one? Sorry, I think I'll give him
Clinical communication.
I'll give him better than. So altogether, I'll just give him 15. 15 over 16. He did well.
Okay, I was writing the skills. Dr. Henry, what do you think about explanation of the surgery?
With surgery?
Yeah, explanation of the surgery.
Yeah, he wastes too much time to me in the surgery. That's wasted too much time. Yeah.
Yeah, is it the time or this is the task to explain it?
No, it is not. It is not the task.
Yeah.
Yeah, it wasn't the task. Yeah.
So I think also this is for the clinical communication. For me, I will down this mark down.
Yeah.
because it's not the task. The task here, and I want to stress on this part, all of us or most of us as a candidate, we forget to mention the name of the disease or the term of the finding, the term of histopathology. This is what Dr. Ahmed missed. Yeah, he mentioned like, colon cancer or cancer colon, but what about the histopathology, Dr. Ahmed? Did you mention that the finding of
Oh,
histopathology?
I didn't mention it, and I didn't mention also that's the staging.
Exactly. That's why I would minus you in the clinical communication. You mentioned cancer colon. You did the golden silence, the warning shot, the diagnosis. You said good news, it's not spreading, but at the same time they wrote in the scenario this is advanced invasive one. So there is local invasion which you didn't respect. You don't know what will happen in the surgery. Yes, he might have surgery, but it might be extensive surgery to the colon, maybe colectomy, total colectomy. You don't know for how long the length of this colon will be affected and invaded by this cancer. However, the good news that it's not spreading to distant organs. Okay, so you can say it in this way. Yeah, it's one. It's by the way, when he asks you, "Is it good news, doctor?" Answer it. You didn't answer it. You just said it's a cancer colon. What about the concern? Is it good news? Tell him, unfortunately, I don't have good news. Okay? What I want to say, any concern should be answered immediately. Otherwise, you will forget it. Is it good news? I'm afraid to say no, it's not good news. Why? Because it's one of the advanced cancer locally spread. It's called cancer colon, however, not spreading outside. But I'm so sorry to say the snip showing that it's invading a lot of the colon locally or in the part of the cancer itself. So by this way, you address the advanced local invasion. However, it's not, as I said, spreading outside. The recurrence, you did it perfect. Safety netting, you did it perfect. We will do follow up. We will do a scan every now and then. The camera scan, we will do also now every now and then. But there is risk of recurrence. Yes, there is. Okay, so it was good to answer in this way. The other question also you answered it perfect. What the cause? You mentioned some of them. You didn't ask him. Is it? Are you doing this? Which is perfect. So alcohol, smoking, some chemical exposure, and you ask about the job at the end. I think for this reason, which is good also. But the surgery here is not the task at all. There is possibility to have a surgery to recover or to remove the cancer from your colon, and we will explain to you the surgery in another session or another meeting, not today. No need to mention the admission because no one asked you to speak about surgery. You are not the surgery. Okay? No need to talk about the complication. Not our task. Our task to explain what you miss in the task and you fulfill it by the surgery, the adenocarcinoma. You can tell him we did a snip and we have a result. Unfortunately, it's one of the most aggressive cancer. It's called adenocarcinoma. I'm so sorry to say that. This is bad news today. I'm so sorry to be the one delivering this news today. Be sure that will be with you on this journey, as you said exactly. Okay? But the surgery itself, I'm against to explain it. You can say, as I said, we will follow up with the surgeon to have a sitting with you to explain everything about the surgery. Okay? Then you can have good time to ask about social. What do you smoke? Do you drink alcohol? What's your job? How the impact on your job? You have any other concern? Any support do you need? Okay? At least you will save 2 or 3 minutes if you skipped the surgery itself. No need at all to mention it. Okay, Dr. Ahmed? As usually, I'm advising stick to the task. If they mention to you, do the surgery, the plan is to do surgery, okay, this is the task to explain the surgery. But if I don't have the task as a surgery, I will not say anything about the surgery, or I can say just one sentence, not in details, and later on he will be addressed in another meeting about this surgery. Okay, this is what I wanted to add. Just to the clinical communication, I will down you a mark, so it will be borderline as well. The concern, you answer all concerns, and don't interrupt the surrogate at all. At any time, even there is a short time to finish, don't interrupt him. I noticed that you are hurried to ask him another question. That's why you interrupted him. They don't like this behavior. They can minus you in the clinical communication because you interrupted him. Let him finish whatever he want to say. Then you can ask. If you don't, you have the time. If you don't have the time to ask, it's okay. But if you interrupt and you ask the question, they might minus you for the interruption and they will not give you good mark for the question. You got my point.
Yes.
Okay, so respect the surrogate whenever he talk, and don't offer to postpone the meeting. Are you okay now, or shall we do it in another time? No, we shall do it in today. I am here to discuss it today. Give him some time to react, to cry. Give him tissue. Give him water. After he will be okay. Are you okay now? Yes. Okay. You want me to explain? Yes, doctor. Please explain. Then you can explain. Whenever you are saying, for example, are you okay, or shall we postpone this meeting? If you have a toxic surrogate and he will tell you, yes, doctor, I'm not okay, what you will do? You will wait again? Or he will leave this station because you told him it's okay not to have the meeting today. So it's not good to postpone or to offer it. Finish the task, give him some time to react, okay? Give him support, offer for water, offer for something else, tissue, whatever he wants. But we have to finish the discussion today because this is my station. I noticed some of doctors saying that they are thinking this is good and something showing the empathy. No, it's not at all. The empathy is to offer something, to be sorry for him, to support him, but to postpone the meeting for how long? And what about the examination skills and the marks? Who will give me the marks if he left? So be careful, don't offer it at all. Okay, Dr. Ahmed?
Okay, clear, Dr. Bates.
Okay, perfect. You have any question?
I
Okay.
have a question. What
Yeah.
should I react when the patient talking long and because time management, how to stop?
Okay. What what he's saying first of all, is it a concern or he's saying something not related? By the way, he has some instruction. He should do it. Let me clarify something, Dr. Ahmed and other candidate. The communication scenario, they must be a surrogate, no patient. Means that he is instructed to do something and to ask you something or to say something. They have a lot of instruction. They have to finish the concerns, and he will not talk. He will not talk haphazard. He has some talk to finish, and he has to do it. Okay, so he will not say something to waste your time. He want to say something to give you the mark. You get it?
Yes.
Yeah. So whenever he's saying to give you the chance to answer him and to address his concerns, he's not saying something which is not related to the station or the situation. In the other hand, some clinical station, the long clinical station, you might sit with the patient himself, okay? And he will give you a lot of complaints. I have a headache which is going down. I have diabetes. I took medication for a long time. You can stop this patient. You can tell him, please, we can go back to this later on. We will come to this later on. We will talk about diabetes later on. If you want to stop him, it's okay. But the communication scenario, this is a surrogate and he has some instruction, some concern. he wants you to answer it. Why? Because he will give you the mark if you answer it in proper way. What if he didn't talk? Imagine if the surrogate is not talking. You will not take any mark. The mark not for the explanation only, for the conversation as all over the station, how to communicate, how to answer, how to let him talk. I noticed one of the feedback recently, one of the candidates passed in Egypt. One of the comment in the feedback, they wrote, the candidate kept continuous talking. Imagine, this is our habit. We are here to speak. No, we are not here to speak. We are here to listen. In the communication scenario, we are there to listen. What he want to tell, then I will answer. What he want to ask, then I will answer. Except the task itself. When I have a task, I have to finish it. Okay? This is the way how to communicate, how to reserve the marks for all skills in the communication scenarios. Don't worry, they will not talk for nothing. They talk to give you the mark. Believe me, the mechanical communication, whenever you are listener, whenever you are getting good mark. If you are kept talking, you might lose a lot of mark because they have some concerns. They are judging on these concerns. If you didn't listen to the concern, they will minus you because you didn't answer it. And it will be also to the clinical judgment, some clinical judgment related to concern itself. How I will get the clinical judgment? By explaining the procedure? No, from the question itself. Doctor, what the if there is any recurrence risk, this is clinical judgment. How it comes, or if there is any recurrence, yes, you can say yes. This is one of the clinical judgment points, and he is the one give you this mark because he asked you this question. Okay. So be listener, be listener, be listener. This is the advice for the clinical communication. Now we will have the open discussion. Anyone want to add any comment?
Dr. Basim, one comment for Dr. Ahmed. Dr. Ahmed, when during the station, after the patient had the emotion and you offered him the tissue and you are started to continue, then Dr. Emeka asked you a concern, but you ignored it and you wanted to drive the discussion. Do you remember what was that concern?
Unfortunately, no. I
No.
was
He was
concentrated
asking you what is the next steps? What's the next step, doctor? So you told him, do you want me to explain about the disease? And you started to talk about what is the meaning of cancer. Whilst the fact that Dr. Emeka was trying to help you by asking what's the next step. Did you get my point?
Yes.
That you were a little bit
Save time.
fixated around, for the cancer, I'm saying everything in my mind that I know about cancer. But it's a very good thing that you do it here to learn or to not to do it again, okay? So don't take this comments like as they say it in English, under your skin, or that we are trying to challenge you. No, not at all. One other thing is that are you aware of the general framework of a patient does have cancer? What usually happens from if a patient got a tissue diagnosis now of cancer, what's the next step will be usually?
Medical team. You mean breaking bad news and
So you broke the news, yes. But what will be the next step? Yeah, no, in terms of medical and non-medical. So medically, what is the next options medically in general for any cancer?
Tumor board.
Yeah, so it will be like surgery, chemo or radio or immunotherapy. Okay.
Yes.
So this is the 4 options of him, because you don't know your station, and it will not be written outside. The patient might have a stand against the surgery. He will be asking, what's the other option? Is there any other option? because your rule is to let the patient know about what is the options. And this what was the question, what is the next step? Well, the next step, the team thinks that's the best for you. And based on the investigation we've done, that there is a good chance that this tumor is resectable. So resectable means that it can be removed. But yet this need to be looked by the surgeon, because they have written in the station that it is locally invasive. It is resectable from oncologist point of view because it's not spreading. But from the surgeons, you are not giving MRCS exam. So you are not consenting for the surgery. And at the same time, you don't know after surgical assessment, upper GI surgeon or the GI surgeon assessment, they would say the tumor can be unresectable. No. So don't provide a promising answer. The tumor will be removed. Sometimes it will be partial resection, followed by chemo, radio. So this is the potential options. So what I'm trying to put in your mind is that be open and focus from a medic point of view. Like you are a medical doctor. You don't do surgery. Because I'm giving this feedback because what I've noted that you try to volunteer to intervene in the other specialty. In the exam, they won't acknowledge this. In this particular scenario, they wouldn't acknowledge this as that you are well known, but you are crossing your border or your rule. You fail to identify or to respect your boundary. Did you get my point?
Yes, Dr. Omar.
Perfect.
So the other thing is that I've written, delayed the patient concern, you didn't respond directly to that. This will be very irritating to the examiners. Other line of treatment, you can spend some time if you do have time, if you think that you do have time and you've addressed the task to explore the other options, chemotherapy, radiotherapy, immunotherapy, which is a new form of treatment by making your immune system attacking the cancer cells itself. We need to have, since we are opening this item of cancer for future reference, the patient told you that I am currently working. You can translate this into your mind as a performance status of the patient is good. He is independent, he is working, he's earning money. Okay. This influence any decision about cancer. If the patient performance is zero, which means
it's of course will change because on the oncological management is dependent on the functional capacity and the performance of patient.
Yes,
there is a score to assess before deciding chemotherapy and which to weigh between benefit and risk.
Yeah, so he might be, imagine the tweak in the scenario, he might be considered for surgery, but he might not be fit for surgery. They will tell you that he is a frail lady with the same exact scenario, but they change the age of the patient and it's frail, she's bedbound, she does have carers. Would you be still talking surgical option here?
Yeah, I think, Dr. Omar, I have this in the case as precision medicine, that each case will be treated individually.
Yes. So this is I'm not I'm trying to cover several aspects in a cancer scenario because it's one of the it is very popular scenario, and if scenario is very popular, many ideas will be rehearsed in it. How you will be sound different than the other candidates within the same exam. Did you get my point?
Yeah.
Because everyone will break the news, everyone will have the pause, everyone will offer the tissue, everyone will be empathetic. No one will will be acting in the other way. But the one who understands the steps, it will help him to navigate through the concern, through the social, through the through the decision making. You've mentioned that we will admit you. Uh, uh, was I right, or because I've heard this, but you can confirm if you said it or not.
I have said because it is so
Do you
so
think he needs admission?
Admission for surgery. He mentioned for the
okay.
surgery. Yeah, before the surgery.
Yeah, yes, but it will be. Imagine that this is why this patient they will write in the feedback unnecessary admission, occupying the bed, unnecessary because you are taking a decision. You have taken a decision instead of the surgeon. Did you get my point?
Yes.
So yeah, at the time of the surgery, you will be admitted, yes, but there is two assessors. One of them might be sleeping and awake at the time you are saying we will admit you. Okay, so they will be they will what, admit, and he will write no. He admitted the patient unnecessary. Did you get my point? I've heard it this way. Dr. Basim was focusing when you said it as relevant to surgeon, and this happens.
Mhm. To be honest, it's not
Mhm.
necessary at all to explain the surgery. That's why I commented on it. It's not
Uh,
important to talk and not to admit, of course. This is another step, not today. What I want to add, as Dr. Omar said, when Dr. Henry asked you what next, he opened the door for you to discuss a lot of options, not the surgery. Yes, immediately or the initial step would be the surgery. However, you might have exposure to chemo, which is a medication can kill the cancer itself, radio, which is certain rays and radiation, who, which can kill the cancer itself or cancer cells, is the same, and biological, if you want to say or not. It's not necessarily to talk about, but the cornerstone, surgical, radiotherapy, chemotherapy. In this way, you give him the options, which is already opened by Dr. Henry as a concern, and you didn't answer it. I agree about this comment from Dr. Omar. What I want to add, and I wrote it in the chat box down, as a safety netting, you have,
Yes.
as you
Uh,
mentioned it already, the
uh,
family.
yeah.
the screening usually I
Yes.
offer when that's cecum cancer or ascending colon.
Okay, but it's not written here. You don't know, and you give him another pathology during the discussion that there is possibility to be a running in families. So at the end, you can offer any one of your family member had a cancer.
This is what I wanted to add. Yes. Yeah.
Yeah,
I wanted
please.
want to take history.
No, no. As I didn't say any family member had history of cancer and question mark. No, I'm saying anyone of your family or any family member had history of cancer, let him or let them visit us immediately to screen for the cancer as a gene or as a code.
Uh, uh, yeah, but Dr. Ahmed have said very have listed the cause very brilliantly, mashallah. But
Yes.
you can ask, is it the case? Yeah, you can ask. Is it not strict?
Mm-mm.
Don't take history at all. If
Yeah.
you are consenting, like in the case, do you smoke? You've asked him, do you smoke? You've listed it as as a potential risk factor. Do you smoke? One other risk that runs in family, any family history. The other risk, it can be related to food. Do you follow any special diet? As you've
Yes.
said it, you use it in this way. No one will mark you down that you've taken history. Don't worry about this.
Yes. Yes. I agree about this.
Mm.
And at the end, also, you can do it at the closure of the scenario. Please, if anyone of your family had the same presentation or had a history of tummy discomfort, let them visit us. Okay, so you can proceed with the if there is, you can proceed with the genetic screening along with the camera scan or the colonoscopy screening. So you have two possibility. Either yes, there is family history. So now I can consider the screening by colonoscopy, or I have certain gene. I should do blood or genetic screening specifically to screen other family members. You know the Amsterdam criteria, right?
Yes.
Yeah, whenever I have this criteria, I should screen all the family for this gene, not as a colon cancer or as colonoscopy. No, I'm doing the genetic screen for the gene itself. Okay, and they have the very high risk to have a cancer. So we have to screen this family. This point will impress the examiner, and he will forget anything you mention. And you will be unique, as Dr. Omar said. All of the candidates will do the same frame, but who will do the specific and the unique technique? You will be the one if you mention something not mentioned in the all carousel. Okay. Yes, thank you, Dr. Omar. Anyone want to comment? Dr. Mahjoub, I heard you today.
Yeah, okay, Dr. Basim,
Yeah.
Yeah,
thank
Dr.
you for
Mahjoub,
this.
how are you doing?
Dr. Omar, how are you doing?
How are
Thank
you
you for
doing?
this great session. Actually, to be honest, I put this scenario on ChatGPT, and to be honest, this concern, the ChatGPT give the answer. It's considered typical or mimic to your review, Dr. Basim, because here the patient also raise the same concern regarding the screening. Just let me to say what the answer. I think the typical like what you said. The screening. Am I going to die? What about this? Yeah. Should my children be tested? This
Perfect.
is then the response or the answer. He said, if you are younger than typical age or have a strong family history, we,
Hmm.
we may refer to for genetic counseling.
Perfect. Perfect. So it will be very embarrassing point if you mention it. Believe me, the examiner like the way if you think outside the box. All of them will break bad news. All of them will do the explanation. But who will think about other family member? Maybe one candidate or maybe no. Who will think about screening or something different? For example, screening after the surgery itself. I like Dr. Ahmed, he mentioned we will do follow up with the camera scan, with the CT, with yeah, the CT and the camera scan to have a follow up on your colon or your gut. It's very nice to mention it. This is what I want all of you to do. So don't think only to the scenario. Don't stick to the task. Yes, after finishing the task, you can do those things. What utilize the time, and from my point of view, it lost the time, the surgery itself. But I think Dr. Ahmed, he can do a lot of things if he have this time. So please don't go beyond your scope or beyond your task. If there is a task, finish it. Don't be volunteer to do something which is not yours. This is a
Oh,
surgeon point, not to be mentioned by you. Yes, sorry.
yeah, no, this is typical what they said here regarding the
Mm-hmm.
surgery. He did not mention except only one sentence. He
Mm-hmm.
said explain surgery simply. For example, the surgeon remove the diseased part of the bowel and
Perfect.
reconnect the healthy ends. This is
Perfect.
only when he touches the
Yes.
surgery. Then otherwise he did not talk about the surgery.
Perfect. So AI today with us, Dr. Mahjoub already mentioned the ideas from AI, right? I
From
like
AI,
the
but
way.
the idea the same.
Yeah, yeah.
To be as
I like to have opinion from the AI or the ChatGPT from anything in your life. Really, it's something. Why you are not using it? Let's
No,
abuse it.
especially if you have no, especially if you have the paid version, you can make the GBT directly for to give you feedback on the stations.
Yeah.
Upload, you can create the GBT itself. It's in my GBT, and then create GBT. Then you upload all of the PDF that's available on RCP website. that contains the feedback form itself, the ideas that in the PDFs, how they will calibrate the case, because there is 2 or 3 PDFs official between the surrogate and the calibration to the surrogate, the calibration for the examiners itself, and you can transform any video into a transcript using the Gemini, the notebook LM, and you can put it as a PDF and put it to the head of the GPT, okay? Because there is official videos on the calibration when the examiners talk to each others, when the examiner calibrate the communication station. And by the way, the one in the video, he was the one who was testing me on the communication station in the last exam, not this one.
How much the subscription for this one? This
It
version
is 20. It's fixed $20. I think it's 20 or 25
per month.
So it will per month, but it worth every dollar that's been spent on it.
Yes.
To be honest,
deserve.
you
Yes.
can sometimes you can have in Saudi Arabia there is a subscription that is paid, that's also paid, but through STC or something like this. My brother told me about it, but I don't live there now, so it comes a little bit cheaper. But this GBT, if you made it, I made GBTs for certain tasks. If you are doing tasks that you are not familiar about, try to put this. He will give you a specific tailored answer for that without any AI confabulation, because it's a phenomenon known to the AI is that he confabulate, fill in the gaps with unnecessary and with false information. The other thing is now that you don't need to type much. You can just open the dictation and say whatever you would like to say that comes into your mind as an instruction when you program the GBT in the very beginning. Okay. Each time you can update the settings of your GBT itself, or in my GBTs, with any new information. So let's, for example, you have a session today and you've gained a new information or new insight about thing, you would like to make the GPT to give you a harsh feedback, a refrain from let's say that please refrain from giving plausible answers or false encouragement. You don't want your GPT to do that. You want him to be strict and difficult examiner. I'll try to create one and share it so everyone can use it. To be honest, I didn't create it before, but I'll try to create the GPT and share it on the group so everyone can use it.
Yes, please. Thank you.
Yes, perfect idea. Thank you, Dr. Omar. By the way, I want to add also to this. Whenever you are giving instruction to the AI or ChatGPT, imagine he can understand what the background you want to understand or to get the feedback from. What I want to say, if you are giving a frequent question regarding the MRCP basis in brackets, he will give you the answer frequently. If he felt like you are asking this related to the basis exam every time, he will calibrate the answer according to the basis recommendation. Imagine how much they are smart. So please, if you have any doubt, as Dr. Mahjoub, in the same setting, you can do whatever you want. And if you want to add something, it's okay. Just have the experience and the confidence to share the comment. It's not, as I said, usually, it's not one-way discussion. It's a lot of interaction between you, as all of you, and me. And if we are agreed, okay. If not, so still we are discussing the things. It's not, as I said, one-way discussion. Okay.
Yeah,
Anyone
but
want
my
to?
advice,
Yes.
Dr. Bassem, don't put the instructions in a chat with the chat GPT. Like if you open the new chat and you put the instruction will be in that chat. But if you've created your GPT, you can flip between normal ChatGPT
Yes.
or let's do say MRCB ChatGPT. MRCB ChatGPT will use the things without keep instructing him in every conversation. Did
Yes.
you get my point?
Yeah, so it will be in the account in the ChatGPT itself.
Yes.
Yes. Okay. Anyone has a question or comment? Thank you, Dr. Mahjoub. You raised this issue again, and it will help a lot of the candidate. Any question before ending the session? Any
No, I
comment?
want to just to thank you very much, Doctor. I am enjoying in your lectures and for everyone participate in this session. Thank you very much.
Thank you, Dr. Yasmin. At any time, you are free to comment, to practice, to participate. So feel free always, as I said usually. Anyone are welcome to practice or to participate or to comment. Thank you, Dr. Ahmed, Dr. Henry in particular. Thank you, Dr. Omar, Dr. Mahjoub, Dr. Yasmin for the last comment. See you tomorrow, inshallah, with a short clinical station day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you.
وعليكم السلام ورحمة الله وبركاته.